Well, we'll start with the first lecture. Introduce first lecture, Dr. Udara Jayawardena, Senior Consultant, Fertility Specialist attached to Colombo North Teaching Hospital. Over to you, sir, to talk on overview of assisted reproductive techniques.
Good evening, ladies and gentlemen, and thank you very much, Diane, for your kind introduction. The topic I'm going to briefly discuss, of course, is about some of the developments that have taken place in the ART field over the past 40 or more years. So simply, in simple words, ART or IVF as commonly known is the most advanced technique that is available today all over the world for treating patients who are suffering from infertility. So simply, it is actually taking an egg outside the body and taking a sperm and allowing them to join each other in a laboratory setup, and after a certain number of days to transfer it back into the woman's womb, so it will be retained and persist, giving as an end result giving a live birth to a live baby. So the first IVF was done several decades back. It was done in 1978. It was actually Dr. Patrick Steptoe and Robert Edwards who performed a successful IVF, and as a result a baby girl was born in July 25th, 1978. That was about 46 years ago. And over the past 46 years, a lot of changes have taken place in every aspect of IVF. So if we broadly divide treatment cycle of IVF, I can divide them into controlled ovarian stimulation, a small surgery called oocyte retrieval, and then the fertilization of oocytes and allowing the embryos to grow, and then transferring it back. So there are advances, changes that have taken place in protocols to make the treatment more efficient and also to make it more safer for women who are undergoing this treatment. Several fertilizing techniques are available. The first all these techniques are still in use. Most commonly used ones are the conventional IVF and the ICSI, but depending on the issues that are in the spermatozoa mainly, sometimes other techniques like PICSI or IMSI also can be used. So the first thing, how it started was initially the sperms and the eggs were mixed in a petri dish in favorable conditions, and those sperms will go and fertilize the oocytes. This is somewhat similar to what happens inside the body. But sometimes what happens is if the sperm count is very low, the sperms are not good in quality, we have to try new things to make the eggs fertilized. So that is how the other techniques developed. In ICSI, for example, what happens is the embryologist catches a sperm and it injects, and he or she injects it into the oocyte itself. So that will improve the chances of fertilization. Similarly, in PICSI, these actually techniques of selecting better sperms. So PICSI, it's a physiological technique, and what happens is we have to put the sperms into hyaluronic acid, and it's to see which sperm is the best to be used for fertilization. Similarly, IMSI is a technique where we look under the microscope and increase the magnification to about 6,000 and select the best sperm. So these things have evolved over the time, but still even the simplest form is in use. And also the technologies to evaluate embryos, a lot of things have changed in this. Mainly, there are techniques to evaluate whether the embryo is a normal embryo, and also there are techniques to evaluate a growing embryo. So usually what happens was after fertilization, we have to keep the embryos in a normal incubator. That is to provide the environment which is similar to inside a womb, so that the embryos will grow satisfactorily. So usually we have to evaluate it on day 3 or day 5. So if you are doing it in the normal route, we have to take the embryos out and look them under a microscope and then see whether they are progressing well. But there are new techniques where now there is a camera that is inside the incubator. So this is called actually embryoscope, time-lapse imaging. So in this technique, the embryos there's no need to take the embryos out. So if you take the embryos out, there is a change in the environment for a short period of time, which might have an effect on the quality and the progression of the embryo growth. So, and also it is a better technique of finding out which embryo is the best. So this is what you get in an embryoscope. This shows how the embryo progresses over time. So we keep it inside for about 5 to 6 days, until which it becomes a blastocyst, which is the best embryo that can be transferred back, and it's more likely to be retained and give rise to a successful pregnancy. And this is another area, pre-implantation genetic studies. There are two main types actually. One is called PGT-A, the other one is called PGT-M. What it basically does is, it's a genetic test that is done on some tissue collected from the embryo and see whether the embryo has the normal genetic composition. If it's a normal embryo that is transferred to the womb, it is more likely to give rise to a normal baby. That is because some of those embryos may be abnormal as far as the genetic composition is concerned. This chance of having an abnormal embryo rises with the maternal age. That's why the older women are more likely to get children who are having genetic issues such as Down syndrome. So this is how you take a biopsy. For example, I'll take Down syndrome again as the example. If you look at the left side, this is a karyotype of a normal embryo. We know that it has 46 chromosomes or 23 sets of chromosomes. But on the left side, you can see the 21 set has actually 3 chromosomes. So you can't detect it unless you test it. So sometimes you might even transfer an embryo that has these genetic abnormalities. So this is called looking for aneuploidity. But there are so many genetic issues, we can't check for everything. So sometimes there are certain illnesses that can be identified in the family tree. So for those kind of couples, we can look at those genetic mutations specifically and eliminate the ones who have those problems and transfer only the normal embryos. That is the advantage of doing this. And of course, the success rate. Some centers, of course, uniformly perform PGT on embryos. But in, of course, our setup, I think even India probably, we do specifically only. If we find that the couple is at a higher risk of having abnormal embryo, then we would recommend to have this test done. But it is also duty of the clinician to educate every patient or couple who undergoes IVF about this procedure. So even when they're at a lower risk, they can make a decision whether they want to test it or not. Because even in younger women, sometimes we can see Down syndrome. So there are techniques of evaluating the endometrium. So finally, once the embryo is prepared, we have to transfer it back to the womb. And inside the womb, there is a tissue called endometrium. This is the tissue that the embryo gets implanted into. So if the endometrium is less receptive, again, even though how good the embryo is, it might not get implanted. So there are some tests that can be done to evaluate this and make changes accordingly. So there's this one concept talks about a window of implantation. It means that the endometrium is not receptive to embryos throughout the cycle. It is only receptive for few days. And this few days is called the window of implantation. It roughly corresponds to day 19 to 21 or 22 in a woman who has regular 28-day cycle. But sometimes in some women, the WI could be earlier than that, or in some, it could be later than this. So if you put an embryo outside the period of WI, then it is less likely to be retained. So in patients especially who have undergone IVF and who have had recurrent implantation failure, this is one of the techniques that is used in the world to evaluate whether we have the embryo at the right time. So this is known as endometrial receptivity analysis. So this test, we have to take a part of the endometrium. Actually, we have to do a mock cycle, just prepare the patient just as for embryo transfer. And we have to take a piece of the endometrium on the day where we will usually do the embryo transfer. But we don't actually transfer it because this is just a test. So we take a piece and then analyze it and see whether the tissue is in the receptive phase. So if it is in the receptive phase, it means we are planning to transfer the embryo at the right time. But sometimes the test will say it's pre-receptive and sometimes it will say post-receptive, and it will also give a prediction about when to transfer the embryo. So that is one of the techniques that can be used in recurrent implantation failure. In addition, the artificial intelligence, of course, like in all other fields, will increasingly important role in our field as well. So in the future, we will see more and more things happening in AI, probably in embryo selection, and then sometimes the robotics may come in. So many things which we can't predict right now, actually. And also, I think in the future, this is still happening at the research level, but in the future, the stem cell researchers, stem cell treatments also may have a big role to play. The stem cells are cells that can differentiate into any type of tissue. These are called pluripotential cells. So if that is the case, we can use these cells to regenerate tissues. For example, if the endometrium is damaged, we can use these cells to regenerate the endometrium so that person will have a more favorable receptive endometrium. So those are the areas actually I wanted to speak because it's a very limited time and we can't cover a lot of areas. I think the next two speakers, of course, will speak more about some other fields. Thank you very much for listening. Thanks.